Good morning and welcome back to Beauty Doctors by Cocoona. I have a very special guest today. He is Professor, pioneer in plastic reconstructive and aesthetic surgery. In fact, he is the first plastic surgeon who did full face laser resurfacing for wrinkles and anti-aging way back in 1995. He is not the one you will find in Instagram, but all or most of the Instagram plastic surgeons that you see have been mentored by him, have been tutored by him. In fact, myself, I'm a big fan of this gentleman. I am a student. I learn a lot from him, and he's a friend now. So I would like to invite Dr. Vakis Kontoes, plastic surgeon from Greece.
Thank you, Sanjay. Thank you very much for having me here. Thank you.
Great. So we're going to have some chat, and I would like to have some insight from Dr. Vakis. But before that, let me tell you a little bit more about Dr. Vakis. Dr. Vakis is in executive board of International Society of Plastic Surgery. He is a very active academician and a plastic surgeon. You will find him in many books that he has published, and one of his books is on Blepharoplasty, which is available online. You will find him in all the big congresses and conferences talking about his technique, showing his results, and I have seen him operating myself. So I'm going to ask some questions to Dr. Vakis. And one of the questions is, what made him come to Dubai?
Well, that's a good question. Well, it's 12 years back when I was invited here for a laser congress, and I was invited to give some talks on laser blepharoplasty, application of lasers, and other things in aesthetic surgery. Then at the end of this congress, a very enthusiastic gentleman came to me and said, we would like to cooperate with you in terms of aesthetic surgery. I had been in the past in Dubai, and I was surprised by its fast development and its trend in concepts that really were very, very interesting. So it was quite easy to take a decision and say, okay, let me start and see what's going on here in Dubai. And I have never regretted.
Thank you very much, Dr. Vakis. What I'd like to know from Dr. Vakis is, what does Dubai have that Greece doesn't? Or what does Greece have that Dubai doesn't in terms of plastic surgery?
That's a nice question, okay? However, I would say it's not Dubai vs Greece. I would say Dubai and Greece together will create something completely different. And why? You know, Greece, Sanjay, as the country where the definition of beauty was born. All philosophers like Aristotle and Plato had dedicated thousands of time for defining what beauty is, and also what harmony and symmetry represents for the human. So they talked about, let's say, the objective part of beauty, and also they talked about the golden ratio, which applies in beauty not only of the face, but everywhere around the world, like Taj Mahal, like Parthenon, like pyramids and everything. This is the golden ratio. So what I'm saying is that starting from there, which means beauty definition, objectiveness, and also golden ratio, there's nothing between Greece and Dubai that will have to decide which one is vs the other. But we are together for what we have as a main and very important target, which is what? Natural results in aesthetic surgery and cosmetic surgery, because cosmetic is a Greek word, cosmetiki. Mm-hmm. So what we want to do is just to bring this cosmetic surgery in the levels that should actually apply all over the world.
That's right. So beauty is actually universal.
Of course it is.
But thanks to bringing the beauty from Greece to Dubai, and we are really honored to have you here. And I'm sure our patients would also like to meet you and consult with you. I have seen a lot of. I have been witness to a lot of conferences where I have listened to your lectures, and I have seen you operating, and I see the way you do blepharoplasty is amazing. I would like you to tell us something about blepharoplasty and how you use laser for blepharoplasty, and how does it make different from the other blepharoplasty procedures?
Okay, yeah, this is a very important issue, and this is what I'm actually pointing out also in my books on blepharoplasty, starting with the title state of the art in blepharoplasty. This is very important. So the recent trends of the last years is completely different regarding blepharoplasty than what was in the past from several plastic surgeons. And the important thing is that the trend now is that we have to maintain fullness of the eyelids post blepharoplasty to avoid emptiness and to avoid heaviness. What I had seen is that this concept is applying in my country and in Europe in general, and it has passed as a message to the people, which I'm working on that more than 10 years, 15 years now for the concept. I'm sure that this will come also as a concept to the region here, because I believe that the exaggerating excision of tissues in blepharoplasty is not a trend anymore. We have to maintain the fullness of the eyelids and the periorbital region exactly the same as we've had it when we were younger. And this is the concept and the mission of laser blepharoplasty.
That's right. So it's about long term. It's not about just
long term. Yeah. Long term and also natural result.
Correct.
Natural result and longevity of results, which is very much supported by these new techniques that I'm applying recently.
And I know that you've been coming to Dubai for a long time, and I'm sure you'll see some differences in the patients here. I myself see a lot of very young patients who wants to do blepharoplasty. What's your opinion on that?
Yeah, this is what I'm saying. I mean, it's sometimes, patients are very much influenced by internet, by Instagram, everything. And they're actually asking treatments for anatomic regions of the face that they do not need to be treated. And this is something that I want to differentiate regarding cosmetic surgery. Cosmetic surgery, and I have to pass this as a message also to our friends who are watching us, as a medical specialty, a surgical specialty, as not a commercial exchange, which means that there are indications and contraindications. That's what I'm saying. And coming to your question, young people are coming and say, I want to do my eyes. But do you have an indication for that? Or is it something that you've been influenced from an external source that you want to go do something regarding your eyelids or whatever? So I would say that this is something very important. And I don't want to talk now about the very important issue, which is the diversity of population in this country. I'm sure that we're going to discuss in the next questions. But the main thing is that indications are there that we do treatments. No indications, we have to protect people from getting into unnecessary cosmetic treatments.
Yeah, very well taken. It's very interesting trend. I'm sure you've also experienced, Vakis. There was a time when the patient didn't want to go for surgeries and they wanted simpler solutions, and people started doing fillers and Botox and threads. And I can tell you with my experience, patients are fed up with that because it looks unnatural. They are overfilled like pillow face, a lot of complications as well. So I have realized there's a lot of patients coming back asking for facelift because they've understood that it gives natural result. So how's your approach with facelift now with these patients who want a quicker downtime, they want to look natural, and they want to be back to work within, say, 1 week, 10 days?
Well, the developments in facelift, which is I would say, the Rolls Royce of a cosmetic surgery, okay, are very important and can help patients go back into their everyday activities after 10 days from surgery. This is my rule, I would say, 10 days, all right. How do I achieve that? First of all, facelift is something that is correcting the gravity symptoms on the face. I know that many patients would go before that for treatments, for fillers, for texture changing of the face and everything. What I would actually advise is that they have to be very cautious with these treatments, not to overdo, because even if they come to the point that they have to do a facelift, everything has to be done under specific regulations and rules, so that for the facelift there will be no problem with the operation itself. It will have overloaded the face with fillers, with other treatments and everything. So one thing is, yes, I agree with fillers, I agree with Botox injection, I agree with texture, skin texture treatments on the face, but under specific regulations and rules, so that if we get into the position to do a facelift after some years, everything will be easier for the surgeon. And here it comes again, the different culture and mentality of patients in the region. This is a multi-ethnic country, and this is nice, and this means that Dubai is offering something different. So many people gathering here. So because you have all these different ethnics here, together with different cultures and different mentality, the plastic surgeon has to delve deep in this situation and treat every different patient as a unique one. Because we have different skin types, different mentalities, different expectations. And this is a very important thing.
Mm. And talking about rules, I have a cheeky question for you. How do you find the regulations in UAE? How is it different than anywhere else that you have visited in the world?
Yeah. Well, the important thing, Sanjay, in this case is safety of patients. Safety of patients and aesthetic treatments and aesthetic surgery is the most important issue and concept. In my capacity as the General Secretary of the Board of Directors and the Executive Committee of the International Society of Aesthetic Plastic Surgery, I can say a word to our friends here that safety is the most important concept that we have as a mission in this society. And how do we get to this safety? I believe that safety mainly is a matter of good education of the plastic surgeon and relies on the hands of the surgeon. However, there are regulations that can support this mission. And I can say that here in Dubai, regulations are a bit stricter than in other countries in Europe. And they change every time, and they are being monitored. And this is good. However, if education and training is not so good, and you do not go by the rules of aesthetic plastic surgery, safety cannot be dependent on the regulation of a health system, but of the clinic itself and the doctors that they actually surround this clinic.
Yeah, so it is combination of everything, the training, the expertise of the surgeon, the regulations, so everything put together makes it safe for the patient.
It's not one-man show. It's two different things that they come together for coming up with the safety and natural results of patients.
So it's very enlightening, Dr. Vakis, to talk to you, and get all the information. One question that we had was, what is the difference you see in the patient population in Dubai versus what you see in Greece?
Yeah. The most important difference is the diversity of the population. Different ethnics, different expectations, different mentality, different cultures. This is good and bad sometimes, but in general, I would say that here in Dubai, you have to have a completely different approach of each patient that's coming to talk to you about aesthetic problems. Why? Because delving deeper into each patient, it's the only way to understand how you have to treat this patient differently. This happens here because it's a multi-ethnic region. In my country, I know exactly what is the expectation of a Greek patient because I've been working with these patients, same of same culture, same expectations all over. Here, it's different, and you have to be completely different. I would say a word, Sanjay, a saying that I love. The noblest art is that of making others happy. So if we consider that cosmetic surgery, aesthetic surgery is an art, because it is an art, although it's a medical specialty, there is only one mission, that out of cosmetic surgery, we have to make patients happy. Patients should come and take services or whatever they're asking for good results, natural results, and only ones regarding surgery. We do a surgery for life. We do an augmentation for life. We do a blepharoplasty for life. We do a facelift for life. Once and go. This is what we have to offer to our patients. Happiness after cosmetic surgery. Because the noblest art is that of making others happy. I believe you agree with that.
Absolutely, and very well said. Yeah.
Now, regarding trend, is something very, very important concept, and is what? Natural results. Okay, what I can say, in Europe and Greece, naturality of result is a very important trend, which I actually do not meet here. Over-exaggerating treatments come as something that sometimes do not make patients happy. And you can see around what I mean by exaggerating treatments of the face. So my counseling here is that I want to bring as a concept the naturality of results, which is something very important. And this is the basic difference between the trends in Greece, Europe, and the region here. So I'm coming to this very important issue again, and I'm actually saying that to the people, that naturality of results is something that has to become as a basic trend in cosmetic surgery in the region. And I believe we have to work on that very, very seriously.
No, exactly. I mean, this is the reason why, and this is what we represent as Cocoona, natural results. And I'm so happy that you said that. And this is what, I mean, you being teacher and professor in education, we want you to educate our people about natural results.
Yeah.
You know? So I think that's very important.
Yeah, very, very important. Education of people is through consultations, through expectations that they're reporting to you, and to match the expectation of a doctor that is thinking for natural results with a patient to take the same message and match expectation. If you match the expectation under this regulation that you have in your mind, everything will change and everything will be better and patients will be happy. And that's what we're seeing. And that was one of the reasons that I joined Cocoona, apart from others.
Thank you very much. This was my next question, actually. Why Cocoona?
Yeah. Well, I can tell you one thing. I am a physiognomist. You know, physiognomy comes from a Greek word saying physis, which is nature, and gnomon, which is judging. And it's a practice of evaluating the character of a person from its outer characteristics and presence. So, being a physiognomist, the main reason that I'm here is you, which means that I really appreciated your mission and your target for development, excellence, and quality in this clinic, and that's why I'm here. I'm honored to have other cooperations in the region, but it's very important, whatever I have decided is through this physiognomistic characteristic that I have.
Oh, I'm honored. Thank you very much, Dr. Vakis. So I think, thank you for all the honest answers and, information that you've given us and to our patients. We would like to come back to you, ask you more about different procedures, and we would really like to know your experience and expertise in that,
Yeah, okay, anytime. But you said, you talked about honesty, and this honesty is the most important thing, Sanjay.
Yeah.
In cosmetic surgery, honesty is the starting point for having people happy after cosmetic surgery, for giving natural results, and for supporting the society regarding the development of cosmetic surgery. So, honesty is very important, and I appreciate that you realize that there is honest response.
Thank you. Thank you very much, Dr. Vakis. Thank you to all our listeners. If you have any questions for Dr. Vakis, he's here for consultations. Do call us anytime. Thank you.